Bronchitis is a virus that causes inflammation on the lining of your bronchial tubes. The bronchial tubes carry air to and from the lungs, and if there is a constant irritation or inflammation of the lining of the bronchial tubes, which is often due to smoking, it will cause coughing and other symptoms of the virus. As your body fights back from bronchitis, the swelling will increase as well as the mucus production. There are two types of bronchitis, acute and chronic. Acute acts more like a common cold, while chronic is more of a serious issue.
Physicians of all time periods have been looking into and studying the virus dating back to ancient Greece. However, the term bronchitis had not been used until the early 1800s when a physician by the name of Charles Bradham first introduced it. And it was not until the introduction of the stethoscope when they were able to determine the difference between bronchitis and emphysema.
Chronic bronchitis is mostly caused by smoking, as about 25% of smokers have bronchitis at least once in their lifetime. However, about 19% of workers who do not smoke end up having bronchitis, which was caused by pollutants in the air.
Since bronchitis is a virus, it can be transmitted through contact with a strand. If cough and or sneeze droplets land on a surface and end up entering someone's airway, mouth, and or nose, the virus can attack the person it enters. You can prevent this from happening, however, by following a couple steps. For one, you should always wash your hands to reduce the chance of catching the virus. You can also avoid all cigarette smoking and secondhand smoking, as they both increase chance of getting bronchitis.
Bronchitis is similar to a common cold, which means the symptoms for both viruses are very similar. The symptoms for bronchitis are cough, production of mucus, which can be clear, white, yellowish gray, or green in color. Rarely, it may be streaked with blood. Fatigue, shortness of breath, slight fever and chills, and chest discomfort.
Treating this, however, is necessary if you have chronic bronchitis, as it can cause disability and even fatality. If left untreated, bronchitis can travel deeper into the respiratory system and result in pneumonia. Antibiotics are not effective, therefore other things are necessary to do. You can visit a doctor and he can prescribe you things that reduce the inflammation and mucus in your lungs. One big helping factor to rid of this, however, is through daily checkups and what they call therapy for the virus.
This is a great example of what happens to your body when you get bronchitis, so don't smoke.